We'll start today's session, and generally, I think we should allot someone to summarize the previous
Good
day.
morning, madam.
Good morning, Dr. Saurabh. Good morning, everyone. So, I think from now onwards, we will ask few participants to summarize what happened the previous day. So, can someone, since I have not assigned, so can someone just summarize in like 3 to 4 minutes what we did yesterday, so that again we all will be on same page today?
Yes, madam. I am sure.
Yeah,
Yes, yesterday we have learned about constructs and variables. What is the operationalization or measurement about variable, and what is about construct. In construct, there is theoretical construct and theoretical construct. And in variable, there is also tangible and intangible variable.
yes, very right.
And about we got some emergent variable also. And from this construct to development of item, and this is coming from theoretical modeling, and this is known as a reflective model. Here we test reliability and validity. And if a theoretical, item will make the construct, and it is the formative model.
Yes.
And for next, we learned about exploratory factor analysis, where we can do that, and error term and zeta term and domains of the construct. Thank you, madam.
Yes, very nicely summarized. Thank you so much, Dr. Saurabh. And like you have summarized yesterday's session very well regarding the formative and regarding the reflective and the error term also. You have told us like how that it is individual to everyone. And only that one thing I would like to add, although you have covered it regarding the direction of relationship. So in case of a reflective scale, it is the construct which is the affecting all the items. So basically, items, whatever we are measuring, that reflects the change in the construct. Whereas in case of multi-item measure or a formative scale or an emergent variable, we use all these three terms interchangeably. Generally, the direction of relationship is from the item to the construct, and we call it as a multi-item measure. And we don't apply factor analysis, or we don't do the validity and reliability studies like we do for the reflective scale. So this was the yesterday, and then I'll just start sharing my screen. So we did all this variance, and I think, let me see. Okay, so yeah, we have discussed regarding the your no, this we have covered. I was on Likert scale. Yes. So steps again, I will repeat. So if you see, we have seen these steps. We discussed that if the existing scale is not available, or even if it is available, it is a paid version. So you can't pay. There are no mechanism that you can pay for the scale. So you cannot use that, or there is no different, like your theoretical construct is different from what you generally there in the literature. So if it is a different theoretical construct, then if it is mandatory that you should develop a scale, then these are the steps. So first step is the establishment of an expert committee. So I said that expert committee should have, since the construct is related to behavioral science and psychology, so there should be a psychologist or a behavioral science expert in your expert committee. There should be a subject expert, and there should be people representation from the anthropology background. Also, there should be language expert. So these experts are needed. If you see, we have given the list of expert who should be there. Yes, so this is the expert committee, a subject matter expert, at least 2 to 3 experts should be there, a psychometrician, a methodologist, one statistician, and a linguist means like if language expert, because you need to change also the language of the scale. And there should be like 1 to 2 individual who are the end user, means like patients or patient representative. So you have to make these many, like take these many people as a expert committee. And we have discussed regarding the definition of construct and dimensionality. Dimensionality means how many dimension, it is only of a single dimension, or there are sub dimensions, like we discussed about the prejudice yesterday, or we discussed about love, that there is, it is not a general concept, rather there are many sub factor or the sub domain of a general domain. Then we discussed regarding the this questionnaire format. So questionnaire format, basically, whether it will be a self-administered questionnaire or you are going to take the interview. So this questionnaire format, it is dependent on the administration, like the researcher, and also dependent on the respondent. So generally self-administered questionnaire, it is given to people who are highly literate, not, I should not say highly, who are literate, and their whose cognitive ability is very good. So, and it depends on the nature of construct also. If it is a very sensitive issue like mental health, or some other sensitive issue like stigma, then you should use a self-administered. Because if you take the interview, because of the social desirability bias, that person might not come with the appropriate responses. So for sensitive issues, it should be a self-administered. And these days you will see that there are various ways to, even for the illiterate people also, there are app and there are data collection processes which changes these literate, like in a audio manner. So anybody who has experienced this, like doing such type of survey on using a audio data collection app, any one of you? Okay, so I think we did one survey. There was a huge qualitative study when there was a ban in Bihar on alcohol. Post ban, the government of Bihar asked us to collect the data on the perception of this ban overall. So because ban, it was a sensitive issue and people, what we did, at that time there was I think that app name was Akashi. So all on that app, the question, we recorded the questions, and there was color coded items, like अगर आप like in it was in Hindi, but like English में, if you agree, then press red color. If you highly agree, then press the brown color or something like that. Then the person used to, and we used to attach that uh, earphone to the person, and the tab was given to the person, and the person used to hear the question if he cannot read it, especially with the females, because the literacy rate in females are less in Bihar. So they used to hear the question in Hindi, and the response they used to fill over that tablet on that app. So that could be converted, even if it is a illiteracy. There are ways these days, because of the technical advancement, that you can collect data even if the person is not literate. But if it is a sensitive issue, and if you are asking the question, because alcohol is like a social desirability bias. If the person takes too much alcohol or too much smoking, he is not, if you are taking the interview, he is not going to tell you the correct response. So related, if it is a sensitive issue like stigma or any addiction, drug, this thing, or any like high risk behavior for HIV also, then those case, it should be, usually it should be a self-administered question. And if it is a complex issue, like one girl, she's doing a project on health literacy, so something which is not known initially to people and it is a new concept, then you might choose to take an interview. So that is regarding the nature of construct. Coming to the target population, again, we have discussed regarding the low literacy versus high literacy. But again, there are ways, even if in case of a low literacy also, you can take the interview using a self-administered way. Next is your research context. So like whether it is a clinical setting or a large field survey. So if there is a huge number of people, like in case of that alcohol survey, we had to cover all 38 districts of Bihar. So that was a very huge survey. So this personal taking interview, it was not possible from that angle also. So that's why we resorted to this digital app. And if it is a clinical setting, when you have to take like 100 patients or maybe up till 150, then you can go for this interview process. Coming to the next step, that is the determining the item format. So coming to the item format, if you see, what do you mean by item format? Means the question, the item. Now you know this term item because yesterday you generated many items. I think approximately we received 61 items on the construct, which was the empathy in general. So if you see the item format, there are many types of item format. First is your binary scale. So if you see the clinical questionnaire, generally you have got these binary scales like yes and no. So basically you give the description to the respondent and you ask the question from a respondent. Like in this case, you have seen the question is, have you visited the doctor in the last 12 months? And then answer probably would be yes and no. So this is a type of binary scale when the answer is a close-ended question and it is in the form of yes and no. It is known as the binary scale, and it is best for gathering like straightforward questions and factual information. So generally for knowledge questions or for clinical setting, the data which we collect, it is in the form of a binary scale. The second is your Likert scale. So Likert scale is again, you have got a option which is more than 2, and it generally it is on the 5-point or a 7-point scale, and it indicates their level of agreement. So you give a question, you don't ask like do you, or you don't give the option in the form of yes and no. Rather, there is a range of option and you ask the person regarding how agree or disagree he is on that particular statement or item, the way you people did yesterday. So like in this case, you can see, I feel confident in my ability to complete tasks at work. If this is the question, you can ask like from 1 to 5, from strongly disagree to from strongly agree. Now, when to use this Likert scale? So it is ideal whenever you are using any construct. So if you see, in case of a scale development, generally we never go for this binary type of scale, and we use this Likert scale, and it is ideal for measuring perception, subjective experiences, and the attitude of the people. So now we will discuss this Likert scale in great detail. So there are various rating number in that Likert scale. There can be a 5-point Likert scale. You must have seen there is a 7-point Likert scale also, and you can have a 11-point Likert scale also. So this, you can say 5, 7, and 11 points, the same scale lengths are preferable for all items in a scale. You won't do like if there are 20 items in a scale, generally you have the same length of item format in all case of the item. It is not permitted that in first 10 questions you use 5-point Likert and in next 5 questions or 10 questions you use 7-point Likert. So the same scale length is preferable for all items in the scale. And because you see that whenever the respondent read that question, what he does. So if I see this question, this one, I feel confident in my ability to complete tasks at work. And then I see the response from strongly disagree, disagree, and then strongly agree, strongly agree, or agree. So if I read this sentence, what is happening in my mind? I am just exploring my psychological domain and see whether I feel confident or not. And if then my mental process, when it matches with the responses which are there in front of me, I usually mark that option. So it should be like that the respondent generally. And you can explain this to the respondent also, because when you go for the data collection, you should always tell the respondent, if it is a self-administered questionnaire, how they should attempt it, because it is new for them for the first time. And if you don't explain them well, there is high chances that the data which you will get, that will not be reliable. And when you perform that Cronbach alpha, you will see that it is like 0.5 or 0.4. Then all the effort of going and moving in the field, collecting the data, will go in drain. So please be cautious. Like whenever you go for this Leica type of scale data collection, whether it is self-administered or you are collecting, then you have to be very much patient and explaining in each and everything to the respondent, so that you can get a correct response. Because otherwise we say that garbage in and garbage out means, if the data collection is not good, you can, by no amount of statistic manipulation, you can get a good result. So I think what we have experienced, 60%, or rather I would say that 70% of your energy should go in the formulation of the questionnaire and the data collection, the correct way of data collection. Otherwise, even if you are highly knowledgeable, you know all the analysis, but you will not get, because ultimately the computer gives the output only based on your data which you receive. So that data is very, very, very important, the quality data which you get from your survey. So this, I told you that I was explaining this, that the respondent confronted with the rating scale, they should execute a mapping and matching process in the mind, and then that psychological mapping and matching with the response. Ultimately, that gives the answer. So what are the conditions which should be met for a rating scale to work effectively? So the 5 point or 7 point, whatever you decide to take, it should offer the entire continuum. It should not leave any option blank. So it should cover all the possible option of that item. And the point should be in the ordinal form, means like strongly disagree to strongly agree. It should not be haphazard. I hope you understand this point, that it should be ordinal. And what is ordinal? Ordinal means there is an order in getting the response. So the second response will be higher than the first. Similarly, the third will be higher than the second, and so on. Like we say for mild, moderate, severe, or a 5-point Likert scale, we start with strongly disagree, then then disagree, then neutral, agree, and then strongly agree. So there is a level, there is a increasing, it is towards the increasing trend, and it is progressing from one end to the other end. And the third is like each respondent, they should have a precise and stable understanding of the meaning of each point of scale. That means they should understand what do you think, like how they, in the case like strongly disagree or strongly agree. So can anyone share from this group how they ask this 5-point Likert scale? Many of you have done this previously. How do they ask? I mean, you ask. And I think I would like to invite what is the name? Ayushi. Ayushi, are you there? Ayushi from AIMS Patna, who was there in the nomophobia project. I don't know whether she's there or not. Okay, she's not there. Maybe she's not listening or busy.
Yes,
Got
ma'am, I'm
busy.
here.
Okay, so Ayushi, did you collect the data of these scales like nomophobia?
Yes, ma'am.
So can you explain the operationalization also of that nomophobia, and can you share your experience regarding that construct to the participants, maybe in five minutes, for like briefly?
Yes, sure, ma'am, I can.
You can share your screen if you like to share. I'm stopping sharing my screen. Do you want to share your screen, Ayushi?
Yes, ma'am, I have a small flowchart where we can discuss.
Okay, I'm just stopping my presentation. Yes. Do you have the sharing rights?
Yes, ma'am, I do have. Is it visible to everyone?
Yes, it is visible to me, I guess. What about the other? Visible. Yeah, okay, it is visible.
Okay, ma'am. So shall I start this? I'll
Yeah,
just
yeah,
take 5 minutes.
yeah. Please go ahead.
Good morning, everyone. My name is Ayushi, and I'm currently working as a project technical officer in the Department of Psychiatry. And under the project where I'm working is on development and validation of nomophobia, which is the fear and anxiety of not having smartphone. So we have tried to develop a scale, and it was a multi-centric study. It was among 3 centers of AIMS. And firstly, we tried to get the literature review, and from there we have developed in-depth interview guide. And along with that, we had 17 students all together who volunteered for this in-depth interview guide and for the item pool generation. And after that, we we had a translation and transcription of the in-depth interview which we conducted, and it was done in both Hindi and English language. After that, we had expert review committee as well, where as ma'am and sir already mentioned, that there were a lot of people, there will be a lot of people from different domains and expertise. And after that, we completed our coding, and a thematic analysis was done, and finally a 27 item pool generation of items was done. And after that, we have completed our study for 3 years. So I would just give a brief about this study, that it is actually a very challenging study, and it is not done by one person. It takes a lot of time, and a lot of professionals are involved in it. Like as we have already been studying for like last day, that it takes professionals to be in this. So that is all, ma'am. That, and this is a small flowchart where I mean, it would give a brief idea that how we actually did and conducted the
Oh, no,
nomophobia study.
27. Okay, thank you, Ayushi. And now I would like you to share some of your challenges which you felt. Maybe like in rather in getting the data, like item data. Once you have once you were, so was it a self-administered or you took the interview?
Ma'am, it was actually self-administered,
Okay.
and it was done during the time of COVID. So the data collection was not properly
Possible.
done,
Okay.
possible. I mean, we had to take online interviews of the students, and the students were from different streams.
Okay. Like from other universities also, like not.
Yes, yes, ma'am.
Okay.
Yes, ma'am.
So how was the data quality? Although we know, but I want you to share. That's why I'm asking.
Ma'am, data collection, when we went for our pilot validation, it was quite difficult because few of the students were not able to understand the question well. And due to time constraint, we had to make them understand that this, for what benefits it will be. And a few of them agreed to participate, and few of them, just because they did not have background about this, so they were not interested. And for few of them also, it was time consuming, because it was, we had for concurrent validity, for divergent validity also, we had some scales, so they were not willing to complete the questionnaire. So these are the disadvantages which we faced during the data collection.
Okay. And what was the time, average time? Because it was a 27 item. So
Yes.
in the pilot, though, it was like much more than that. It was very big. So what was the data collection time in the pilot and what was during your actual like 27 question?
Ma'am, for 27 items, it was around 6 to 8 months, along with the expert reviews.
So
So
that was the total duration. But for one person, like if I have to take that nomophobia questionnaire, how much time I have to spend on filling the answers?
ma'am, for an individual, it was around 20 to 25 minutes.
Okay. And what about the pilot?
Ma'am, for pilot, I think the same it went, and but it took almost 3 to 4 months for the completion of the data collection.
Overall process. Okay. Thank you, Ayushi. Thank you so much.
Thank you, ma'am.
Then I think I would like to invite Supriya. Supriya, are you there?
Yes, ma'am.
So can you share your experience of translation of the scale and how you have done the pre-testing and pilot testing?
Yes, ma'am, sure. I'm sharing my screen. So is it visible to everyone?
No, Supriya, it's not. Yes,
Oh,
now we can see.
so good morning, everyone. I'm Dr. Supriya. I'm doing my PG thesis under the guidance of Dr. Pragya ma'am. So I'm doing this thesis on the topic antenatal depression. So I'm estimating the prevalence of antenatal depression using this APDS scale. Although this scale is available in the public domain, so there are total 10 items in this scale. And the Hindi translation of this scale is also available in the public domain, but it has been translated in the Madhya Pradesh region. So there, because of the regional difference of Hindi language, there are some words like you can see in the first question, like मैं हंस पाई हूँ और बातों का खुशनुमा पहलू देख पाई हूँ, and सबको अनावश्यक रूप से दोषी माना है, like पर्याप्त कारण ना होने पर. So these words and these lines might not be understandable by the rural local people of Bihar. So for this problem, I have translated again the questionnaire into the local Hindi language, which can be which should be understandable by the people. So questionnaires were given to the people who has a better command for both English and Hindi knowledge for translation. So for my thesis, I have given this if I have given this questionnaire to my friends, like school and college friends, so who knows both the English and Hindi language better, and and they have already experience of this local regional language of Bihar. So these were the translation I have got, like this one, this, and this. So after analyzing all this translation, I have made a common final version of the translated questionnaire. So this is the final translated questionnaire I have made from all those translations. So to understand the difference that to understand the change that this final questionnaire, the final Hindi questionnaire I have made, that it can be differ from the original EPDS questionnaire. So to understand this, I have back translated this Hindi questionnaire in English with different set of peoples. So these were the back translations again from the Hindi questionnaires. This one, this, and this. So after analysis that the meanings of the questions is not vary from the main questionnaire, so I have applied this questionnaire on the 30 peoples for pre-testing in the same geographical area and apart from the participants who were actually taken in the study. So in this pre-testing, I have faced a problem. Like initially we have planned to ask the questions in the population who came for a PMSMA clinic, like Pradhan Mantri Surakshit Matrit Abhiyan clinic. But especially on the specific days, like at 9th or 21st day. But on the 9th and 21st days of PMSMA days, there was a huge crowd. So I could not able to ask the questions properly. So after discussing this with Dr. Pragya ma'am, we have changed the strategies. Like I have made a change. Like we will ask the questions in the regular day. So after that validation, and these questions were applied in the main study. So thank you.
Okay, thank you, Supriya. So you
Yeah,
can
ma'am,
stop
shall I
sharing.
stop sharing? Yes.
Thank you so much. So yes, there was a question that how many experts should we have? So like Supriya has shown you 3. So she contacted 3 her friends because it was a PG thesis. So we could not contact on and another till that time. I wasn't. We were not aware regarding a linguistic expert here at AIIMS Patna. Probably at that time. So now since we have got an expert here, so we can take help from that expert also. But those people who don't have access to expert for usual activity, whether it is a small project or a postgraduate thesis, you can take help from your friends or colleague also, because generally as a you people will act you people can act in three role. You are expert also, you are bilinguistic, and you know the local language also if you belong to the same state. So you can also take a decision what to keep and what not to keep. So this was regarding the translation which we learned yesterday. So although this was a very simple, and you see that generally we say, if you ask from anyone, they will say very casually, there's no need to translate, it is already available in Hindi. But like I was saying, Hindi also have like many dialects and many words. Hindi from all these 3 and 4 regions, they are different. So that's why you should translate, even if it is Hindi, whether it is applicable in your situation or not. And the words you can see like khushnuma and those things that people of Bihar, they don't speak that those kind of word. So if you are going to speak, it will be like they will feel that they are alien to particular this thing, and they will not be able to understand. So that's why what we feel that you should work very diligently on this questionnaire and the language of the questionnaire, because that will decide the quality of data which you collect. So again, now coming back to this, thank you, Supriya and Ayushi. And this, Dr. Seetal is asking, so the item can only be in scale format, unlike the multiple choice or subjective questions. Yes, item should be. Item, if it is measuring. Item we call, like multi-item is also an item, for like socioeconomic state or human development index. But item for a reflective scale, we are talking about items for a reflective scale, it should only be in the form of a Likert scale. If it is in binary or any other form, then those particular reliability validity study, you cannot do over that. Yes, for a multi-item measure, you can have maybe like a 3-point scale or even yes, no. But in case of this reflective scale, it should be on Likert scale. So like I was saying it should cover the entire range, and each respondent, they should have a precise and clear understanding of the meaning of each point on the scale. And then like if you want to add some more points, like if you want to add like from 5 point to 7 point, then it depends on the like mental level of the people, their cognitive abilities. I think there was a question from one of the participants regarding that language. Okay, so Dr. Sushmita is asking, after translation in a particular local dialect from a scale in public domain in the publication, we need to take permission for it. At least, yes, you should inform. So you just put a mail. You just write that you are like in case of you are postgraduate student from this and this institute or in this capacity, and you are using this scale for academic purpose. So a mail should be sent so that you have done your part, and definitely you will write that you will acknowledge. We will discuss those issues also, but yes, even if it is in public domain, you should send a mail to the person. Then Dr. Latika is asking, Dr. Rupesh is asking, in yesterday exercise on empathy, do we need to generate items in Likert scale or only on just question would it? So no, you have generated item. Now you have not formed the response, but the response will be on the level of, it was only the exercise of item generation. The format or the scale of response, that's a different exercise. And you can decide, that's what we are discussing, that you can take it on a 5-point or a 7-point. So yesterday we did not discuss that. It is different. Item generation activity is different from deciding on what, like how many point you have to take the response. Dr. Sushmita is asking, after translation in a particular language of a standardized scale, yes, it needs to be validated. Validation is always needed. You can directly go for reliability. Validated means whenever you say this term validated, it has got many meaning. First is a reliability. We'll see that. So you need to do the reliability of the data which you have got, and then you need to perform the validation. And in validation, you will see that there are many types of validation. once we are through with all those concepts, then you can decide. But definitely, it mean you will do a exploratory factor analysis. You will do a confirmatory factor analysis. Again, there will be an issue of sample size, which we will discuss. But ideally, if you don't want to do a EFA, so these questions will be more, I would be able to answer this, or you will be able to understand this more if we cover the entire session, the exploratory factor, confirmatory factor. But again, till now, if the answer would be yes. Dr. Sheetal is asking, so the items can only be in a scale format, unlike the multiple choice. Yes, true. It should be only in form of a scale. Now, next question is iterative process. No, that you have answered now. How Dr. S.S. Rai is asking, how many translator and back translator? Minimum is 1. Even if you have got 1 person, that is okay. But generally, we take 2 to 3. It depends. Okay. So these were some of the questions which you people asked. So what is the value of adding more points? So more point, it depends on the cognitive ability of the person. How refined the people mental abstractions are. Like if you see the clarity of these points meaning. So if it is a 7-point long, then how you write, you will see that the responses are like strongly agree. So you put this word like strongly 2 times, or strongly disagree. But again, if you increase beyond the 7, then point meaning become like the wording becomes useless. You cannot write like strongly agree, like you see here. How will you write? Here, like you can see, we have written like this, strongly agree, and we have written strongly 3 times. So this doesn't have that means the meaning will not be conveyed. So better if you want to use scale like more than 7 point. Generally, for people of India, it is recommended that you should use 5 point or 7 point, not more than that. But if you see the literature from the UK, USA, there the mental abstractions are very clear. So they generally go even up till 11-point scale. So if it is a 9 or 11-point scale, then you can have such lines you will see, and the person can tick on the line. So strongly disagree on one side and strongly agree on the other side. You can have such options for a 9 or 11-point scale. Now, third is your rating scale. So what we did till now, we have discussed binary scale, yes or no. Then we discussed Likert type of scale, 5-point, 7-point, or 11-point. And then we are discussing rating scale. Okay. So Dr. S.S. Rai is asking, can you combine binary scale and these ratings questions? So yes, if it is a knowledge attitude type questionnaire, you can combine where you ask attitude over Likert scale, and knowledge you ask on yes and no, because knowledge you don't ask whether it is like whether they know, whether they do not know. So in any CAP questionnaire, you will see you mix, there is a mix of questions. There are questions on binary scale also, and there are questions on the this Likert scale also. So yes, it can be combined for a usual, but again, and open-ended also you can keep. There's no issue. You can have. Again, but for open-ended, you need to decide on the analysis type, whether you are going to make it close-ended later, or you want to keep it open-ended like a qualitative analysis, excerpts and the thematic generation. That is up to you. So yes, you can have. Dr. Priyanka is asking, do we need to validate CAP type of questionnaire? Yes. Any questionnaire, even the, like yesterday, one girl was discussing regarding the PG thesis where we collect the type of data in the clinical setting. There also you need to validate. Validation will be different. You are not going to do the discriminant and convergent and the predictive validity, but definitely for content validity, like you people did yesterday. All of you attempted the exercise yesterday. So 34 people have done it. And you will see that there were 4 domain which we asked: the relevance, the ambiguity, the clarity, the language, and all those stuff. And you rated on a point of 1 to 4. So that was regarding the content validity of that questionnaire. So you can have such type of activity for any questionnaire, even if it is a binary type. Because for binary also you will see that many postgraduate students, they collect even the perception question or attitude question on a binary scale. Like they will ask, do you smoke? Smoking is okay, but regarding the attitude towards smoking, if they ask if the questions, if the response format is in yes and no, then you will not get those shades, and that analysis, you will not get that variation in the response. So many times what happens that response is not always in the form of yes and no. We are not always sure of no, and we are not always sure of yes also. So most of us like fall in between. So if there are no options in between, then we are left with no choice, and then we mark those extreme choices. So yes, it should you should validate the CAP type of questionnaire also. Is it clear all the questions till now, or do you have to ask anything else? Then I'll go ahead. Okay, thank you. So coming to the rating scale, like I said, like respondent rate an item on a continuum, like this visual analog scale, VAS, that is a rating scale. Generally, pain scales or NRS scale, those are on a rating scale when the person rated from 0 to 10. Or like how this question is there, how would you rate your overall satisfaction with your healthcare provider? So again, you can have a rating scale which will go from 0 to 10. And this, it is effective for the capturing the intensity of feeling and experiences. So this rating scale. So example is the visual analog scale. So now Dr. Richa Nigam is asking how many validators we need for content validity. We are coming, Dr. Richa, we will cover this topic, but again, since you have asked this question, minimum of 3 experts, 2 or 3 experts, maximum you can have up till 10 for this content validity. Dr. Seetal is asking knowledge questions on rating scale. Knowledge questions, yes. Generally you ask in yes or no, whether they, maybe you can have, I have not seen knowledge questions on rating scale, but yes, you can have. Let me explore this more on regarding the knowledge questions. What do they think? We need to see the item. What are the items? And depending on the item, you will decide on rating scale. So rating scale is dependent on the items which you have generated, whether it is for the knowledge or any other construct or domain you want to assess. So now another type of scale is the semantic differential scale. So this scale measures the meaning of many things, and like semantic, you just give the name. Like if I ask this question here, please rate our experience with our service, unfriendly and friendly, and you use these two extremes, and in between you have got all other shades. So this is like a semantic differential scale. Now, what you will decide for choosing this item format? So these are the consideration. You just see first the nature of the construct. So generally, if it is an attitude or a feeling, you decide on a Likert scale. If it is an awareness or knowledge, you decide about the multiple choice question or a yes/no question. If it is regarding the respondent characteristics like the literacy level, cognitive, it depends on their literacy level, cognitive abilities, and their cultural background. And you need to understand the burden also, because if the respondents are very burdened by your questionnaire, like many of you say also, like if you get bored towards the end, you just go on filling the options without reading the items. So this response burden, you should consider the length and complexity of the scale. You should prepare your scale. It should not pose a burden on the person who is filling. Like Ayushi said that it was taking approximately 20 to 25 minutes. So that much time is okay. It should not exceed more than that, because if you have to spare 40 minutes or 35 minutes on one scale, I don't know how much a person will be willing to spare that much time, unless on a self-administered this thing. If you go and talk, that is okay. Since you are there, he cannot deviate. But for a self-administered, if it is very lengthy, generally people, they lose their track and they lose their attention span. So it depends on the attention span of the person also. So regarding how to decide on this respondent burden, generally you should keep 10 to 20 items. Then generally it is considered manageable for the most respondents, especially if it is a self-administered form. And Then you decide on the complexity. So we should not have complex words or jargon. It should be very simple wording, and this should be in the Likert form. And time should not be more than 20 minutes. Generally, it should be between 15 to 20 minutes. And you can pilot test this. While you do the pilot testing, you can just see the time. You can ask a few of your colleagues and friends to fill the question. Definitely, your cognitive ability will be much more than a patient's cognitive ability. So we will discuss this pilot and pre-testing also. What is pre-testing and what is pilot testing? And you can see this in the pilot testing, how much time it is taking. And then you can see what are the ways how you can reduce this time. These things are very important, because if you just go and give the scale, then again there is a problem. People, they come up with the data when the data is not reliable at all. You perform the Cronbach alpha and McDonald omega, and it keeps on coming like 0.4, 0.5, then the whole exercise has, it's all, it will be wasted. So you again have to go and collect the data. You cannot change the data, or you cannot manipulate the data. You should not. So you have to again collect. So deciding on these, once you are designing it should, you should put a lot of effort in taking care of these things, like time required, the respondent burden, the item complexity and simplicity, and depending on the cognitive ability and attention span of the people. That is also very important. So we have discussed this item format, and now coming to the item development. So item development, how will you do that? So like Ayushi has just shared how she developed those item pool. So generally we do the literature search. So literature search, you can get the reference of the existing scale and the idea also. And then you do the in-depth interview. So this qualitative technique, it is very much inbuilt with the scale development process. If you are doing a scale if you are in the process of developing a new scale. So you have to do the in-depth, like she did the interview with 15 to 16 students, that on video call, probably because that was a COVID time. So key informant interview, what is KII? So in qualitative, you know, KII is people who know well about that subject. So maybe that phobia, because no mobile phobia is related to phobia. So there can be other phobias, like there is a, you know, all this terminology, there is a phobia from height, there is a phobia from water, there is a phobia from a closed space. So all those phobias will be a general construct, and in that there is this nomophobia as a special type. So you can interview experts, you can interview students, and then you can take those sentences which they have, like when you analyze it, when you have got that verbatim, you should try pick up developing the items from that verbatim, and that will be your initial item pool, which Ayushi was just sharing, and that will be very huge. Maybe generally you should try to have, if you have to make a scale of like 20-25, you should have at least 100 to 125 items. Yesterday also you could see that there were approximately 61 items, and we then I'll tell you the process what we did. We just remove the duplicated one, and then we make those final item. So, and you can have focus group discussion also, and you do the clinical observation also. In this case, you will see that the inflammatory bowel disease, there is a scale. So that scale, many items that clinician took from the clinical observation of the people. And then again, you will take the help of the theory also, because while you are defining the phobias, you see all those theories which are there in the literature. So now the few tips for developing the item. So in first, you should use the short and simple sentences. So yes, Dr. Rupesh has asked this question. In odd numbered Likert response, 5 to 7, the individual can respond as 3 or something in center, which is not towards any end, and thus would reveal no result. Can the Likert scale be even numbered so that at least we can finally analyze the individual agree or disagree? Yes, you can do. Many people, they take it on a 4-point. You will see that 0, 1, 2, 3. Like we have also given you the content validity, that was on a 4-point scale, 1, 2, 3, 4. That was not on a 5-point scale. I think this general health questionnaire. So I'll show you few scales where it is not on 5-point Likert. It is on 4-point. So you force the person towards going to one side. You don't encourage that person to remain in a neutrality state. So yes, you can do that. And you will see that many scales have that. So you should use the short and simple sentences. Then second is your like yesterday also one person was saying regarding that time of low mood, that you should have a reference time period. So like in this case, the question is, have you had headache and fever in the last 24 hours? So that person has given the 24-hour time frame. But what is the problem in this question? If you see this question, two aspects. Yes. So I'm asking headache and fever both. So these are very simple, but if you see the questionnaire very intricately, even when we analyze, we see that the postgraduate student, they ask two questions at one point of time. Then what will I say? If he has fever, then he will say yes, or if he has headache, then he will, or both. So I cannot delineate regarding this, headache and fever. So one symptom, especially in clinical setting, we have seen this, that they ask frequently two questions or symptoms at one point of time. So we should ask only one piece of information at a time. And these things you will see in the content validity. Okay. The item formatting and their response, basically, that is very important to check whenever you go for any questionnaire, which is not like a reflective scale, which is a general questionnaire, which we usually develop for the data collection for our PG thesis. So tips for developing now, again, third, you will see that the question in the last 24 hours, how many times did you not have dizziness? So what is the problem? Did you not have dizziness? So it is a negative. So you should avoid the negatives if possible. And have you had headache before? Again, what is the problem in this item? What is the problem in this item? So when before?
Time is not specified.
Yeah, very true. And this one, have you had neuropathic pain before? Time, and there's one more concern.
Neuropathic pain might not be a term that a respondent can understand.
True. So the term, you should not use these medical terminology. So this was regarding the item development. So remember, item development, how it has to be done. It is pure qualitative in nature. You have an initial pool, and then you take the help of few experts to short down that questionnaire. Or generally it is done. Ayushi has done with the help of people. We have also got a content validity done. And these days, with the help of this email and Google form and other data collection form, even if the person is at a distance, you can get these content validity done just by inviting people over mail who are your colleague, and maybe even if they are not your colleague, someone from your profession or someone related to your profession, you can ask for the content validity. So this determination of the scale length, how will you decide? Again, like I said, you have to take care of this respondent burden. So generally 10 to 20 items is considered manageable. And we'll see in reliability also that if you go on increasing the number of items, reliability increases first. But after some time, there is a plateau. So even if you increase the number of items, there is a saturation and the reliability is not going to increase after that. And time, again, we have discussed this 15 to 20 minutes. Then you have to review and revise the initial item pool. So how to do that? So you will select that. So first you will either you have translated the scale or modified the existing scale to fit in our local context, what Supriya did, or you are planning to develop a new scale, what Ayushi did. Ayushi developed the new scale, which was on nomophobia, and Supriya already did a work on the validated scale. So in both the context, you do the pre-testing and pilot testing. Now coming to many people, they get confused with this both two terms. There is a term which is known as the pre-testing, and there is a term which is known as the pilot testing. So the slides which we have made, this is using a reference of a SAGE article. And SAGE is considered to be one of the best publisher for these qualitative and scale development, all those books, even 2-3 books are there from the Sage publication. So we have taken reference from that book and we have shared also with you people. If we have not shared, we'll share with you. So there is a difference between pre-testing and pilot testing. Now, one of you can read first scenario. Now focus on this scenario. Can someone read this for us? Scenario 1.
Yes, ma'am, I'll read.
Thank you.
Scenario 1. Dr. Patel is developing a new questionnaire to measure patient satisfaction in a hospital setting. She selects a small group of 10 patients who recently visited the hospital and asks them to complete the questionnaire. After they finish, she sits down with each patient to discuss any confusing or unclear questions, gather feedback on how they interpreted the items, and makes necessary revisions to the questionnaire based on their input.
Thank you so much. Now you have just see this. Now coming to the second scenario. Who will, can someone read this for us? Then we'll discuss. So you first before you start reading, so what this Dr. Patel has done, she has taken a small group of people of 10 patients, and then she has completed, after that she discussed it with each of the patients and regarding any ambiguity or clarity, and she has gathered the feedback, how they have interpreted the items and the questionnaire. And then she did the revision. This was one activity which she did. Now, in the scenario 2, yes, can someone read the scenario 2?
Actually, that line is not visible, the first line.
Sorry, yes, talking, I'm sorry.
Okay, I can read now. Senior scenario 2.
Yeah.
Dr. Singh is launching a new aimed at improving the diet and exercise habits in the community. Before rolling out the program to the entire community, he implements the program with 30 participants from the community. He monitors how the program operates, gathers feedback on the materials and procedures, and assesses whether the program is effective in changing diet and exercise habits. Based on this experience, he makes adjustments before the full-scale launch.
Okay, so now you have seen the scenario 2 also, that he went to the community, he took the participants, and he rolled out the methodology which he has to do on a large scale. So now you have got two terms, which is pre-test first in this. So let's discuss first pre-test. Scenario 1 or scenario 2. So Priyanka is writing scale 2 is pilot. Okay. Yes. So you are right. Scale, this one is pre-test. Aditi, Shruti, Priyanka, Ayushi. Yes, you are right. Scenario 1 is pre-test and scenario 2 is pilot test. So you know what is a pre-testing and what is a pilot testing. So basically pilot testing, we call it as a dress rehearsal. So you do dress rehearsal before any event. You just try to exactly simulate the situation when it is going to happen. You must have seen, like in convocation, we do such type of activity, convocation activity. Like all the students, they come, they go on the stage, then come down, the way everything is like rehearsed. So this dress rehearsal is the pilot testing. And in pilot testing, what you just see the feasibility of your intervention, what you have done, whether it is possible, because all these studies, they are drafted sitting in the room, and many times it is not tested before you roll it out. So we have also had one experience. One, Supriya has told you, she did a pilot testing because initially she thought that she will take the data from the PMSMY day. But when she went on the PMSMY day, she has seen that the crowd was very huge and the ladies, they were not willing to respond to the scale. They said that we don't have time and we are not going to give you the responses. They are very busy. So then most of them, they were not willing to give the consent because it was a PMA-SMA day and that was very hectic and they had to rush for many activities like from testing, then examination, collecting the report and going back home. So what then she has seen Supriya, what she has decided that it is not so. She has changed the protocol, and now she told that she will go twice, thrice in a week, not only on a PMSMA date, but other days also when there are less patients. So then she could gather the data, she could collect the data when the patients, they were comfortably sitting and there was no hurry for many to get for in the hurry of the services. So this she could do because she pilot tested the whole study in few, like for, we say number is generally 15 to 30, that is okay. We say 5 to 10% of the total sample. And then she did the reliability also, because in pilot testing you do the reliability analysis also, just to see that the data which you are getting, because if you do the whole of your study and the reliability of your data which you have got, that is very low, then it will be difficult for you to go and collect again those many data. But if you check the reliability on small number of subsets, small number means we can say 30 to 50, then again you can check the reliability and you can be doubly sure that if the reliability is there in 30, you will definitely get it in more number of patients. So that is very much required, because later you cannot change the responses, and don't try to manipulate the data just to get the good reliability. So this was regarding the pilot testing. And pre-testing is like when you refine the questionnaire, and pre-testing is done at the level of experts also. We'll discuss that. So this we discussed regarding the pre and pilot testing. So pre-testing is about you fine-tune the tool like questionnaire to ensure that they worked well as you intend to do. And pilot testing is about testing the entire process on a small scale to ensure everything works smoothly before the full-scale implementation. Also, I'll share one story. We are doing one project on La Bike. La Bike is like, it is again a multi-centric ICMR funded project. So it is a lab on a bike. So we had to field test that La Bike, and there was a concept of home health guide. So home health guide was like, we will recruit few people from the community who will be like responsible for 20 to 25 individuals, and they will help the patients to raise test for to call the bike for the testing. Because what problem we anticipated that the labs are very distant, and the people, because of the travel issues, they don't go to the lab to give their blood sample. So because these lab bike will test the blood sample at their doorstep. So, but we did not, that pilot testing was not done before we rolled out that intervention. So we had difficulties in getting the patients, because these home health guide, they were not working without getting any remuneration, because there was no remuneration in this project. So they said that we don't want to be like a home health guide. So this issue of we did not discussed earlier, and there was a budget of all those home health guide, their examination and everything. And right now, although we recruited those home health guide, but they're not working the way we anticipated. So we could have done that, pilot testing in one of the area. And now, because it is going on in like seven areas of all over India, so 7 states. So we could have done it on one state or one small area, and we could have seen the feasibility, whether it is feasible on a large scale or not. And then we should have implemented it to the entire multicentric study. So there is a role, definitely it carries, it helps you in saving time, saving energy, saving your money also, budget. Because otherwise you will not budget that particular item for that activity. So that was a few experience which we had regarding the importance of pilot testing, whether it is a small scale study or it is a large scale study. So first you should do a pre-testing, and then expert committee will decide regarding the further action. And this entire process is iterative, means if your scale reliability is low, then again you need to repeat the process. So once you have the final version of either the translated scale or a newly developed scale, you have to do a pilot testing before starting the full scale study. And that we have discussed 5 to 10%. And ethical clearance is needed for pilot testing. So you can, because ethical, you can only do any part of your activity once you have got ethical clearance. You should not start taking any of the data before you get this ethical clearance from your institute. So pilot testing is applied again, like we have discussed. The part is to check for the content validity of the scale and to check for the internal consistency of the test. So finally, you have got the version 1 of the developed scale to measure your construct of interest. So I think whether you have got a translated scale or whether you have got a newly developed scale, the path is same, that you have to conduct the pilot testing for the scale validation. So now, yes. Now, again, the question is, even it is one person has asked also, like even if it is a validated scale, do I need to validate it in a well-established, well-established scale also, do I need to validate it? So yes, answer will be definitely yes. So let's understand that this with some items of empathy scale which you people have developed. So like if the scale item, we have taken this item directly from the Toronto empathy scale. So the question is, maybe, or any empathy question item, if it is like this, I often help people who are less fortunate than I am. Okay, if this is the question, so this question, there is a cultural relevance. You need to test if the cultural background of your population is different from the population where it is tested. You need to do the validation again in your setting. Like there are many cultures where helping people is a part of their culture. Like if you go to like US and many area, you will see that they pick all the garbage. Even if there is a wrapper on the road, they will not wait for the municipal corporation to come and pick that wrapper. They themselves will pick that wrapper and throw it in a proper dustbin. So for them, throwing garbage in open is like a learned behavior. Similarly, there is a population also, many tribal people, or in many areas, when the people, they teach their kids that yes, you have to help people who are less fortunate than, and there are many religion also, like especially you will see in Christianity, there are many missionary hospital, they believe a lot in these health. So because of those characteristics, their religious background, or because of their familial trait, they might do this activity. They will say yes, highly agree, but they might not be empathetic from inside. It is just the learned behavior over long period of time. So in that cultural reference, if you actually want to assess empathy, you should have that empathy, whether that is a cultural trait which they have acquired or it is a personality trait. Now coming to the second question, it is there that I sometimes find myself feeling tender, concerned, and compassionate towards people less fortunate than me. Then again, this has got a contextual relevance in the medical setting, because if you are saying that in medical setting, the medicos, we train them that you should be compassionate and you should help people. Many people, they take medical because they want to serve people. So if because of their profession, if they find like they are concerned and compassionate because of their profession, then definitely it is not going to tell the empathy in a person. Again, if this is the scale item, if the scale item is, if this item is for the empathy. So if this question is like, I find myself crying at the movies. So if this is question, you want to see the empathy, because in movie, you see there are many times a very emotional scene and people start crying inside the movie. But if you ask this question from a male, so he might think that, a male is not supposed to cry. So even if he cries, he will say, no, that I don't agree with this, or I strongly disagree. So it depends on I think it has been others, this thing. It will be norms around interpersonal interactions. For that, don't read that red one that has been wrongly written here. So this, I find myself crying at the movie, this will be norms in the society on the interpersonal interactions. Like male, they are not supposed to cry. They should be strong. So if you ask this question, they will deny, even if they do. So that is one question. Again, if you ask this question, I enjoy listening to the other's problem. So the frame is like, it is a idiomatic expression. So that person might think, no, I don't enjoy listening to others' problem. So there is a problem with the idiomatic expression and language. So because of that, even if the scale is validated, you need to validate it in your own setting because of the cultural, contextual, interpersonal interactions, and language issues. Is it okay up till this part? Are all your questions answered regarding the need of validation, even if it is a validated, even if it is available in your language, and other issues? Or do you want anything to be repeated? Okay, Priyanka is writing yes. Okay. Okay, thank you. So coming to the dimensionality of scale, so unidimensional and multidimensional scale. So what is a unidimensional scale? So first have a look at this question. This is a general health questionnaire 12 and there are 12 questions. So what is about the domain? It is a single domain or a multiple domain? So Ayushi is writing single. Yes, because you can see that there is no delineation and all the questions are there in the single general health questionnaire domain. Now see this. WHO quality of life brief questionnaire. Multi-domain. Why? Because you can see there's a global item, there is an item on the physical health, there's an item on the psychological domain, there are items on the social relationship, and there are items on the environmental quality of life. So yes, there are multiple domains. You are right. So you know regarding the difference of multi and single, the multidimensional and single dimensional. So I think that is okay. We can skip this. This I am just skipping all these definition. You know, we have done that. Now coming to the breakout room activity. So before we do the breakout room activity, I will just show you how to see the content validity. So content validity, we will, I think let's first take their theoretical part. Then we'll go to the breakout room activity. Let me see. So this is up till, so this, remember in that sequence, we will do the reliability before the validity. So how is the sequence? You first have translated the, if it is a already existing questionnaire, you have translated that, you got the back translation, you have seen the, decided the final item, and then what you do, you ask for the content validity also. So content validity is done before reliability because that will give you the final version, and then you go for the reliability. So content validity, generally it is done the way we have shown you yesterday. You did that exercise. Let me open that exercise for you people. So it is in day 1. So this was the sheet which was shared with you people. So you have like, there were 34 people who responded, and this was the content validity method. So you have been provided with a sheet, and this was this list which you see, this was the list of original item developed by the participant during workshop. So if you see, there were 1, 2, 3, 4, total of how many? We got 61. If you see this number, this is 61. So we total had 61 items. So what we did then, this was the, we has just removed the duplicate. So any duplicates or overlapping content, we removed. So these many questions you can see 17 questions, there was a duplication. So after that, we had a final questions. This one, you can see the final items, item pool. So the final item pool was total of 42. But we have marked these questions as red because from 38 to 42, they were the negative questions. So you should know in your tool which are the negative questions, because when you test the reliability, you need to reverse scale those negative questions. So in this scale, I would write separately, like item number 38, if I choose to keep these items in my questionnaire, I'll make a separate note that item number 38 to 42 is a negative statement. Like, I'm not able to see the pain of a person suffering. I'm more aggressive when people are sad around me. So these are the negative questions. Now coming to the exercise, basically we have seen that there are 4 concepts on which you should rate your item. First is the relevance. So relevance, so if you see the content validity, that is done both subjectively and objectively. The first one, which is the relevance, you just see that how relevant is when how relevant the item is, and that you have rated from a scale of 1 to 4. 1 is not at all, then slightly, 2, 3 is somewhat relevant, and 4 is highly relevant. And then regarding other also, like clarity, simplicity, and ambiguity, you have rated all those questions. And this is these are the number, like you have to give this rating 1, 2, and 3 and 4. So generally for content validity, we use 3rd and 3 and 4. We take number of people who have given 3 and 4, like that slightly relevant, we don't take that item if it is slightly relevant. So we take only those items which are mostly clear or mostly relevant and completely relevant. Okay. So how to do that? So we had this Excel sheet. So this was the Excel sheet. So there were, we took the response of only 6 items. We have not given all the items because then it would be very time consuming process for all of you. Rating all those like 37 items or final item. How many was there? Final one?
27.
Okay. So you can see that we have received these many responses.
That is number of response.
No, 34. Response to 34 people responded. So you can see Nitesh, Rudresh, Rajat, Tandra, Swati. One person was not named, Rakesh, Jenny. So these were the responses we received on 6 questions. So how to do the content validity? So basically in content validity, there is 2 types of content validity. Let me open the slide before I tell you this exercise. I think it is in day 2 now. Day 2. Scale validity. Okay, Dr. Rupesh is writing clarity and ambiguity would be opposite. If one item is very clear, it would be unambiguous. Yes, you are right. So coming to the validity of scale. So basically what is validity? So we will again discuss these concepts when we'll do the factor analysis. But when you are trying to measure a construct, are you measuring the same construct through item? That is the validity. So validity is only when what you want to measure, the measurement or your score which you have got, is it the true reflection of your construct? That is the validity. So we'll see that if the scale is reliable, it does not guarantee that the latent variable shared by the item is the variable of interest. What does that mean? If you get a high reliability, that is 0.8 or 0.9, that doesn't mean that the scale is valid. Why valid means all the reliability means all the items, they are reflecting the same construct. But is that construct is the same construct which we have intended to measure? That is the validity. So there are various types of validity of a scale. Like there is a content validity, there is a construct validity, and there is a concurrent validity. So I am not discussing these two type of validity, the construct and concurrent, because this we will discuss tomorrow. This is in case of a factor analysis. So right now, before reliability, we do the content validity. So we will discuss this content validity first. So again, just to classify, this construct validity is classified into the convergent and discriminant validity. So I am discussing content validity. So content validity is what? The items which you have selected, are they representing the construct or not? This is your content validity. So the definition is degree to which an instrument has an appropriate sample of item. That is your sample of item for the construct which you are going to measure. That is your content validity. Now, what do you do? Why do you do the content validity? So you do the content validity first is for the sampling adequacy. That means there may be initial pool of 150 or 100 items, like Ayushi said. And then you do the content validity to reduce the number of items. You get the responses, and then items which score less, you remove that item. So for the sampling adequacy, you just see and do this content validity. The second is content validity is easiest. Like in this case, you can see you just example that in many contexts, it is well defined. Like in case of this example is given in the Robert, that all the vocabulary that should be taught to a 6th grader, it is very much defined that what vocabulary you have to teach. That is again the content validity. But in case of a scale, you have to do it. But when the issue is very like fine and very abstract, like measuring a psychological domain or a construct, which is a theoretical one, like attitude or perception, then choosing the appropriate item from the pool of a bigger item is a very important task, because that will determine the reliability of your scale. So this is again one example which we have taken from that book, Robert. So they have this Turba and colleague, they again set out a measure to measure a dyadic efficacy. What is a dyadic efficacy? This dyadic efficacy means if there is a couple and one person had rheumatoid arthritis, how the couple in which one partner had rheumatoid arthritis, they perceive their ability to manage the illness as a team. So this was the dyadic efficacy was the construct. So this was different from self-efficacy. There's a self-efficacy construct also. But they again redefined the self-efficacy or arthritis-specific self-efficacy to a dyadic efficacy. So in this context, they have again redefined the scale using the content validity. So normally the content validity is done in 2 phases. Okay, so there is a question from Dr. S.S. Rai. What if someone important items are left? Those might not be thought of or added in the initial version. Initial version, generally what you pick, you have got a very big pool. If your scale item, like final item is 27, you might have a pool, initial pool of 100, 150. So you cannot say that this will be added or this will be lost, because how you have generated the additional pool, the initial pool? Yes? Can you guide me how you have generated the initial pool? When you select the people for key informant interview or in-depth interview, you take all those important excerpts, and there are experts involved in the generation of item pool. Generally, you don't miss out. Yes, definitely. If you carry out this activity in a hurried way, not patiently, or if the experts are not the experts, real experts, then you will not be able to have an initial pool. And the other thing which you have written, what if some important items are left? Now, what do you consider important? what you think important might not be reflected by the people who are be the interviewer, like interviewer for you, who will be the participants for you. So you see, because ultimately you have to do the research on study subjects. So that those important items you will not miss if you select the people from the community for an initial interview or for the key informant interview, because perception from those people will have most of the time, if you conduct the interview well, all those important items will be there in that pool. And ultimately, you cannot say that a scale will measure. Again, remember what we have discussed yesterday. The true score of a scale is it gets reflected in these items, but it will not be 100%. That's why, remember, we have written the term error. Error will always be there. Any scale cannot measure 100% of the construct. Any item cannot measure 100% of the construct. It is near. There will be a gap between the true score and the observed score. Did you get your answer, Dr. Roy?
Yes, ma'am. Yes, thank you, ma'am. Thank you for clarifying, ma'am. Thank you.
Okay, thank you. Okay, Dr. Latika is writing video is not available. Okay, can you see the charge? Okay, that battery maybe. Okay, we are changing it. So, content validity, it is done in two phases. The first is it is done by the researcher. So the researcher, because he has developed that operational definition, the theoretical definition of the construct. So researcher, through the careful conceptualization of the construct, does the content validity. And second is the evaluator. You have a pool of experts and they do the evaluation like you people did in the yesterday exercise. And don't take the yesterday exercise, just take it as a process. Usually we don't have so many items in one day. Since it was a random activity which we did yesterday, ideally you do it through the in-depth interview and key informant interview. Yesterday you wrote only from your perception, but generally it is done after the interview process, but take it just as a process. So we generated 61 items yesterday. So again, you people evaluated. So you people were evaluator. So you did the expert assessment for relevance of each item. And like the number of experts, I think Dr. Latika asked that it can range from 2 to 3 experts to maximum of 10, depending on the number of experts. If you increase, you need to have, there will be more of disagreement. So generally we suggest that don't take more than 10 experts, because we said that more people, then there will be an issue of consensus building. So how to interpret this? There are ways to do the content validity. You can have a multi-rater agreement using kappa statistics. You can have a content validity ratio, or you can have a content validity index. So generally, with what we will show you the content validity index. So content validity index is the most widely used to measure this degree. And this content validity, we do it at 2 levels. Content validity of individual items, like we gave you 6 items, and content validity of a overall scale. So these 4 points you receive, like not relevant, somewhat relevant, quite relevant, and highly relevant. And then item is considered valid. So we calculate 2 types of content validity index. There is a item-wise content validity index, and there is a overall scale-wise content validity index. We'll see how to calculate it. So both should be more than 0.8. You will keep only those items where the content validity index is more than 0.8, and you will take this overall scale valid if overall scale content validity index is more than 0.8. So the cutoff is more than 0.8. This is another method, which is the content validity ratio, where experts rate the item as essential, useful, and not necessary. So you only take one essential item in this. And there is a Lossy method of calculating this content validity ratio, where you take the number of essential items. Essential means those people who have written it as 1 minus n by 2, and n is the number of experts. In denominator also it is the n by 2. And this is, Loshi has given the value of content permissible value. So if the number of panelists is 5, the minimum value is 0.9. And you see, if you increase the number of experts, the minimum value, the acceptable value is like less, 0.5, 0.49, and so on. So we'll see the content validity on your data set, how to do that. So this was the Excel sheet. So how to do the content validity? So what I did, I have to count all those people who have given any item score of 3 or 4. Why? Because 3 or 4 was the relevant and highly relevant. So what I'll do, there is an option in Excel where you can write the countif. So I have to count all those people who have scored 3, who have given the score of 3 or 4. So I will write here equal to, and then I will give the option of countif. So you can see there is option of countif, and then you have to give range. Range means I have to go to the number 1 person, which is the Nitin. So from Dr. Nitin, I would keep on selecting all the people coming to Vignesh, Latika, Smarnika, Anjana, Bhumika, Rupesh, Richa, Bhavna, Dr. Latika. Number of experts are more, otherwise last is Dr. Priyanka. So I have given the range. Now you need to put a comma, and I have to count the number which is more than equal to 3. But you have to put it in the double inverted comma. And then press enter. So if you see enter, you will get number of people. So 31, if you see item number 1, 31 people out of 34, they have given the 3 or 4. Similarly, if you just double click this, you will get the number of people. Only 7 people have said that this is relevant. 13 people in item number 3, 13 people have said that this is relevant. In item number 4, 32 people, item number 5, 31, and then item number 7, 19 people. So how to calculate the content validity? You divide this number of experts who have said it is relevant to the total number of experts. So what I will do, 31 divided by 34, because total 34 experts, they have given the response. I have just pressed the enter and I have just clicked this. So now coming to the item wise individual item. So will you keep this item, the first item? The first time, will you keep it or not? Okay, Priyanka is answering yes. Okay, good. Coming to item number 2, which is 0.2. Will you keep this item? No, because it is only 0.2. What about item number 3? No. Good. What about item number 4? Yes. What about item number 5? Will you keep it? Yes. What about item number 6? No. So very right. So you can see there are out of 6, there are 3 items who has scored. Item number 2, item number 3, and item number 6 who have scored less than 0.6. So, sorry, less than 0.8. So we will not keep this and we will remove this. So again, now what you can do, overall, if you see the overall scale reliability, how it will be done. So you can like just, I have applied this formula. What you can do, you can write is equal to average of all this individual. You can take average and you can select and press enter. So you can see the average is 0.652. So the overall scale reliability is also poor. So what you will do, you will delete these items. You will not take item 2, item 3, and item 6. You remove this and then again calculate. Your overall scale reliability will also improve and this item-wise reliability, sorry, not reliability, I'm sorry, content validity index, CVI, it will improve. So now, have you understood how it has to be done? Last item. So Excel formula has to be 1 or 2. Which one? I did not get Dr. Selvaraju. More ambiguity. We are seeing for relevance, not for ambiguity. I will show you the original Excel sheet. This was the original Excel sheet which we received for all those items. For relevance, for ambiguity. Okay. So Dr. Bhumika is asking, ma'am, there are 34 experts we take. Can we see value according to law sheet? Generally, I said that you should not have those many 34 experts. I'll tell you with this regarding this content validity of we developed a blueprint for community medicine, and we have contacted I think 40 people, and we could get only 16 as in the last, because for many people they won't be able to see your questionnaire. So generally Loshi, yes, if you are able to get those many experts, but again, you have to calculate the content validity using Loshi method. And in Loshi, we take only one. So for Loshi method, if you have to use, you have to write a countif 1, and then you have to subtract n minus 2. So 34 by 2 will be 17. So in numerator, you have to minus 17, and in denominator, you have to divide it by 17. So if you are using Loshi method, then you can use that value depending on 34 experts. Is it okay? But generally, you don't get those many, since you people were there as a participant, so you people could do it. But it is difficult to get those many experts. So even if you have like 5 to 10, that is, you are quite lucky to get, because this is our personal experience. And I don't know about Ayushi. Ayushi, how many experts responses you could get? That is probably our experience, that we could get maximum, I think, 60.
Ma'am, even we got around 10 experts review.
Okay. So even if you send invitation to many, now you will get yes or to be, because generally we don't provide anything. Provide means what is the incentive for them to be as expert? It is generally on the personal contact, or maybe if you request them. Otherwise, there is no monetary gain for those people, and even like name is also, you don't put their name as a in the publication. So you will not find many people. Yes, if it is a funded project, and if you have like some incentive in the form of anything, then people might be able to join your expert team. Is it clear? Okay, Dr. Bhumika said it is clear. So now, and this was the overall Excel sheet, which we got. So this green color is only for relevance. Similarly, this light yellow color, it is for the clarity, and this was regarding the ambiguity. This third and last one was ambiguity, and this was for the simplicity. So you don't have to, we have shared this data, this sheet with you people, and you have to do the calculation using this sheet, clean sheet. You can see this clean sheet for analysis. You have to do this you can only report like mean score regarding this both to proportion, like how many people have said that this was clear, and that you can write in your, or maybe you can use that ambiguity and the clarity and the simplicity. But for this content validity, we only check for the relevance, because it is measuring your construct. So for construct, generally it is the relevance which is the most important part. Am I making myself clear to all of you? Then we'll go to the breakout room. Okay, Dr. Selva Raju has written yes. Okay, so Dr. Akash.
Yes, ma'am. So I'll open the breakout rooms now.
Yes.
Okay. Okay.
ग्लूकोज खत्म हो गया